Do you actually need Botox in your 20s? Stay tuned to find out. I'm Dr. Peter Chng, consultant dermatologist.
I'm Dr. Lu.
I'm Dr. Chai.
Many of my patients actually come in their 20s and ask what they can do for their face to maintain the youthness.
Actually, the skincare goals change as the age evolves. So let's start with the 20s. Our 20s is the decade full of life, energy, and sometimes neglecting the skin. But here's the thing, this is the decade to build a strong foundations. Because at this stage, our skin still produces a lot of collagens, and the goal here is to maintain good skin quality and preventing early damage. This means prevention is everything. By prevention, it means think of consistent skincare routine, hydration, and sunscreen as your best friends. So here's a common myth. I'm too young for sunscreen. But no, because sun damage starts early. This radiation, UV radiation from the sun exposure, it can exacerbate the breakdown of elastin and collagens, and this leads to the premature aging of skins. So if you ignore it now, it's going to show up later in your life. Years down the road, it can appear as wrinkles, pigmentations, sagging, and so on.
Skin cancer.
Sorry.
And skin cancer,
yes,
yeah.
and so on. So always wear a sunscreen, even though it's cloudy, even when you are indoors. When it comes to treatment-wise, keep it simple. For example, silk peel, which is a popular non-invasive monthly treatment that can deep cleanse your pores, hydrate the skin, and also extract at the same time. And skin booster to improve glow and hydrations. Also laser toning to treat early sun damage, uneven skin tones, and dullness. So the key idea here is preventions over corrections, and start good habits now and your future self will thank you.
There are also like topical retinoids that I would recommend patients, because it's one of the topicals that has a great abundance of evidence to show that it helps in the anti-aging process. But I always tell them to start slow, go every other night first because it can cause a bit of dryness. Once they're used to it, then go every night. It's a night cream. You're not supposed to wear it during daytime because it's photosensitive. So during daytime, you're going to get some eczema problem if you wear it during daytime. And also in their 20s, we see a lot of patients with acne as well, right?
Yes.
Yeah.
We always start with topical, either retinoid, like the night cream that you use. It also helps with the anti-aging as well. And also we can use a lot of clascoterone or the new topical medication as well. If they go more severe, then we should consider antibiotic and also oral isotretinoin.
Yeah.
That will help.
Yeah. And for those who doesn't want oral medications, another way is also to use lasers. For example, Aviclear, right? We know that it targets the sebaceous gland. It destroys the oil gland and therefore helps with the acne. Now, what about patients in their 30s? What are the treatments that you will recommend the patients?
Yeah, when patients come to me in their 30s, right, usually they have more fine lines and then the skin look a little bit uneven. They will start complaining about the open pores a little bit bigger. Normally what I would suggest, if they have a lot of dynamic line, a lot of expression line, I think there's a time that we might need Botox already, because Botox actually can relax the muscle and then to prevent further permanent line in the future. Other thing that we can consider for patients with uneven skin tone and also open pores, we can actually do laser genesis. It's a very gentle lunchtime treatment for patients. It takes about 20 minutes, very fast, no pain, and then you give you a very even, bright, full skin color tone.
We have quite a number of patients.
Yeah, we have a lot of patients actually like it very much. They do it monthly.
With us for 9 years, 10 years, and just continue to use this kind of treatment.
And nobody know what you have done. You just walk in, you've done the treatment, and then you go.
And when they look at the before and after photos, they can see, actually, I look greater than before,
Yeah, even the age also, they look even good. Okay, another procedure that we always like to ask patients to do, this multiflex. It's a fractional laser. This laser also very gentle. It has very mild downtime, like 2 to 3 days, and then sometimes a little bit sandy kind of peeling. It also even out the skin tone and they help with the pores as well, which is the main concern in this age group.
Because that lasers have two wavelengths, right? One that goes deeper in to stimulate the collagen. One acts on the more surface area that helps with the pigment as well, so it evens out the tone.
Yeah, you actually get two benefits. Yeah.
So moving on to 40s, what are your opinions?
Yeah, so patients in their 40s, right? Majority of them will have sagginess problem. The face starts to sag and they start to have volume loss. Right? So for sagginess, normally we will recommend energy-based devices because that is the one that gives the most natural look of it. For example, we recommend things like using Altera Prime, which is using ultrasound to heat up this thin layer of muscles we call SMAS layer that can help to lift up the skin. And whereas things like Morpheus, which is a microneedling radiofrequency, it can target the fat layer, the middle layer of the skin, as well as the top layer of the skin. So with that, it stimulates collagen and as well as tighten the skin. You can also tighten the fat. Because as we age, the sagginess happens because the fat starts to sag down. And when the fat starts to sag down, that's where you see the lines, when you start to see your jowl. So if you can target this fat, tighten this fat, you actually improves the overall sagginess of the skin. But certain areas that it's not only because of the sagginess of the skin, but it's also because of volume loss. For example, our tear trough, which is under your eyes there, it's because we lose fat at that area, the skin starts to thin down, and the bone starts to resorb. So with that volume loss, we need to fill it up. And what can we use to fill it up? We can use collagen, we can use hyaluronic acid to fill those areas up. Also, for more elderly patients where the skin is really saggy, sometimes we can recommend threads as well, using thread lifts. As for patients who's going into menopause, once you go into your 50s, then because of the menopause, the hormonal change will create a lot of hot flushes, and also the skin starts to become very dry. So that's the time when you start recommending patients, for example, skin boosters to hydrate the skin, and also certain topicals, certain creams to moisturize the skin even more.
And rather on relying on single treatments, combination approach often yields better results. And also the key here is to go for a subtle, well-planned treatment over time, rather than placing a large volumes of fillers or overly aggressive treatments to maintain this facial balance and also support healthy and natural aging.
There's no one-size-fits-all kind of treatment, right? So we always emphasize on individualize the treatment according to the patient's needs.
I think the earlier you start the treatment, the better it is, and then you might not need filler in the future as well.
And also, I think the key principles that applies for all age are hydration matters at any age, sunscreen is essential, and choose a treatment that suits your face, not just follow trends or follow age or follow your friends. And lastly, go for these subtle, natural changes rather than drastic change.
We always emphasize on patient-centered approach. So please talk to your doctor to discuss what is the best treatment plan for your age.